What is Guillain-Barre syndrome? Guillain-Barre syndrome, pronounced Guillain-Barre, is a rare autoimmune condition where your immune system attacks your peripheral nerves. Peripheral nerves include the nerves outside the brain and spinal cord, such as nerves of the face, arms, and legs. Key facts: Guillain-Barre syndrome is a rare autoimmune disease where your immune system attacks your nerves. The cause of Guillain-Barre syndrome is not known, but it usually starts after a viral or bacterial infection. The illness may start with tingling and weakness in your legs that spreads to your upper body and can lead to almost complete paralysis in some people. Many people with Guillain-Barre syndrome need treatment in hospital. You are likely to recover significantly over the first year, but some symptoms may continue throughout your life. What are the symptoms of Guillain-Barre syndrome? The first symptoms of Guillain-Barre syndrome are usually weakness or tingling sensations in your legs, which may then progress to your upper body and arms. Symptoms can be mild or severe. In severe cases, you may develop almost total paralysis. Symptoms can also develop very quickly over a few hours or slowly over weeks. In most cases, they peak within the first 4 weeks. You may also have difficulty moving, for example, walking or moving your eyes or face, pain, difficulty controlling your bladder or bowels, a fast heart rate, low or high blood pressure, difficulty breathing or swallowing, blurred vision. How is Guillain-Barre syndrome diagnosed? To diagnose Guillain-Barre syndrome, your doctor will ask you about your medical history and symptoms, examine you and assess how your nerves are working, refer you for tests such as a lumbar puncture to check your cerebrospinal fluid or an MRI to help confirm your diagnosis. Diagnosing Guillain-Barre syndrome is difficult, especially during the early stages. This is because the symptoms can vary between people and progress at different rates. If your symptoms begin more quickly and severely, you may be diagnosed sooner. How is Guillain-Barre syndrome treated? In the early stages, most people with Guillain-Barre are treated in hospitals so doctors can monitor your breathing. If your breathing muscles are affected, you may need to be on a ventilator in an intensive care unit, ICU, to help you breathe. Guillain-Barre syndrome can be treated with plasma exchange, which involves removing part of your blood and replacing it with plasma from the blood bank. Intravenous, 4. Immunoglobulin therapy, using antibodies from blood donors to alter your abnormal immune response. Medicines, to relieve pain and prevent blood clots. Physiotherapy, which should begin as soon as possible to help prevent blood clots and support your rehabilitation. There is no cure for Guillain-Barre syndrome. How long will I have Guillain-Barre syndrome? Most people eventually fully recover from Guillain-Barre syndrome, even if they were paralyzed or needed a ventilator. Rarely, people continue to have some symptoms for life. Complications of Guillain-Barre syndrome. Complications of the initial phase of Guillain-Barre syndrome can include blood clots due to reduced movement, breathing difficulties or pneumonia, aspiration of food into your lungs due to swallowing difficulties, pressure sores, infections, delirium. During your recovery and rehabilitation, you may experience fatigue, medium black circle chronic pain, psychological distress that may include mental health conditions such as anxiety, depression. You are also at risk of suffering from differing levels of permanent disability. Any complications will be managed by a multidisciplinary team including your specialist doctors, nurses, physiotherapists, speech therapists, occupational therapists, and dietitians. Thanks for watching. Subscribe for more such videos.